To accredit people, you need standards to compare them with. The new workforce accreditation standards are certainly still with the committee in draft form, but I have two here which should give you an idea. Draft Standard 1. Aged, community and disability workers have the relevant skills and qualifications to undertake the role for which they are employed. That makes sense. How do you prove that? Number one, the employee holds a relevant AQTF nationally accredited qualification in that field, such as a Certificate 3 in aged care. Again, it makes sense. But that's not actually mandated anywhere. That is industry common practice. But it's not written down anywhere. You don't have to do it. But as we've all agreed, it does make sense. It's probably something we might like to write down, codify. Number 3, the employee maintains records of their qualifications CPD which can be produced for audit. Except for the nurses who work for you, do you know any of your other staff would actually keep a register of what they do? I meet a lot of carers and I say, where did you do your Cert 3? And they go, don't know. That is the most common response I get. It's not pushing a lot back onto them, but it's saying, you really are a healthcare professional. It really behoves you to keep a track of what you've done, where you've worked, and the different skills you've amassed during that time. Draft Standard number 2. Employers of aged, community and disability workers maintain a register of required regulatory checks including, but not limited to, police checks, working with children checks, with evidence of renewal every 3 years. Number 1, you're probably doing by the personnel record. But number 2, evidence of competency register and defined scope of practice. Example, endorsed enrolled nurse, peg feeding competency, catheter replacement competency. I would hazard a guess that most places I go to don't have that. But again, it's something you really should. The aim of these standards might just be to put meat on the bone for what is already written in the Act or in the standards, or it might just be industry common practice or best practice that we're writing down, such as having a Cert 3 in aged care. They are meant to support you in your day-to-day operations.